Welcome back, everyone. Well, taking care of our hearts can sometimes seem like a daunting task, but luckily our friends at Owensboro Health offer a lot of services to help, including cardiac therapy. And here to tell us more is Manager of Nursing for the Owensboro Health Heart and Lung Rehab, Sarah Abel. Thanks for coming by
thanks
today.
for having us.
We're excited to have you guys again. We had you on yesterday and we talked cardiac as well. Now we're talking about cardiac rehab. So kind of tell us what we're talking about with that.
It's such an important component and often not utilized, sadly, but it is a program that people are referred to by their physician, and it's following an event, usually like a heart attack, or if they needed to have a stent placed or having open heart surgery. People preparing to have a heart transplant, or if they have congestive heart failure. So it just helps people improve their heart health in a healthy way.
Yeah, and it can make a big difference. Who's on your team there?
Oh, goodness. Well, we have several nurses. They're all registered nurses. They're all advanced cardiac life support registered. We have an exercise physiologist who also is employed there. And then outside of that, because we have the wealth of knowledge of everybody at Owensboro Health, we collaborate with pharmacists and dietitians and counselors, chaplains, and so forth. So you just get a wealth of knowledge.
You really do, from all different areas.
Absolutely.
But all for the same goal, right?
Yes, yeah, absolutely.
So when we're talking about it, how long is someone usually in, or does it vary a lot, like in cardiac rehab?
No, when you're referred, it's 36 visits per event, and that's 3 times a week, so that usually is about 12 weeks. Now, sometimes we'll adjust the schedule. People work, you know, whatever, and so if they need to come twice a week, that'll extend that out, but it's 36 visits. And the more you attend, the better outcome you have.
Consistency.
Absolutely. Yeah, the people who attend the full session, the full program, that you will see a 57% reduction of future cardiac events and reduction of dying with a cardiac event because you've gone through this program.
And you've gotten stronger, you've done what you're supposed to do. Do you give them kind of things that they can do at home too?
Yeah, so the plan is to prepare them for after they go through cardiac rehab. Cardiac rehab in an outpatient setting is considered phase 2. Phase 3 is when we give you your graduation ceremony, you get to go home, and then you need to continue that lifestyle that you've learned over the past 3 months. So,
and that's so important.
That is so important. Yeah, we try to give everybody the tools to continue to be an independent, healthy living person.
So where can we get the cardiac rehab? Where are you guys at?
We're at the Health Park location at the hospital in the medical office building side, and it's just a beautiful floor plan of exercise equipment, very nicely laid out. It's comfortable. We have about 10 people at a time. It's enough room for anybody to have whatever equipment they want at the time. We combine that with education, with information to help people learn how to manage their stress, how to decrease their risk factors.
It's everything. You kind of put it all together. I love how you kind of bring all of that together. So if you mentioned your doctor sending you, is that the only way to kind of get started with this?
Well, it is. You need to be able to have a qualifying diagnosis and be referred by your physician. And then we have an individualized exercise plan for each person. There's an injury session where they talk to you one-on-one. They go through your individual case and develop an exercise plan for you. And then we have a physician who reviews that routinely and makes sure we're on the track. We send that information to your doctors. And we're also the eyes and the ears of your doctor. If we see something trending in a way that shouldn't, then we let them know. We can spot that. It's subtle changes that if we can get on top of, then we can keep something else from happening. And then we teach you how to look for those too.
Exactly, yeah. Teach us what we should be aware of.
Absolutely.
Thank you, Sarah, so much for coming in today. We appreciate it and everything that you told us. We're going to be right back after this. Stay with us with Local Lifestyles.